Hello, YouTube. Hello, hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Friday, January 10th, and I thought I would just do a quick drop in support group meeting for interstitial cystitis, overactive bladder, chronic pelvic pain, pelvic floor dysfunction, IBS, vulvodynia, any patients like that who might have any questions. Now, my purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can ever mess with you again. You know, I want to use the F word there, but I'm not gonna. It's one of those days. Hello, Libby. It's nice to see you. So I don't know, man, I worked really late last night, been working on this brand new project. I really want to show you guys. And I just thought, I'm totally in the mood to come online and stream. So I thought I would do that for an hour or so and see if patients have any questions. Here, I'm going to print this out because I want to show you guys what I'm working on. Hello, Cecilia. Hi, Sue. How are you? Happy. You know what? Our new year was very, very mellow and just the way I liked. Just the way I liked it. Hey, you know what? Listen, if I could get, I posted a picture. It was the 71st New Year's Eve for my parents. They met, my dad is 97. They met when he was 26. They married when he was 26. And he's now 97. They've spent 71 New Years together. And so and they stayed up and they kissed at midnight. It's adorable. Posted a picture. Hi, Sarah. Hello, Anna. Hello from Brussels. Nice to see you. Hi, Kay. So you guys, I'm going to be doing a lot of new things this year. I'm going to be doing a lot more streams. I'm really excited about that. I'm going to be doing a lot more support group meetings, a lot more videos. Literally everything I'm doing is going to be focused on video and internet. Hello, Linda from Indiana. Oh, Linda, I'd love to know why you think you're flaring. Any clues? Kay says, how painful can pelvic floor dysfunction be? You've been bedridden for months. I've never heard it can be so bad. Yeah, hun, it can be, because seriously, if your muscles are so tight, they're inhibiting the ability of your ability to even move and even walk and even sit on the side of your bed. That could explain one reason why you're more bedridden. And part of this project that I'm working on, that I'm going to show you, is I'm doing this. Well, I'll show it to you in a minute. It's printing out right now. One of the reasons we absolutely need to stretch out muscles is that nerves that support the bladder go through muscles. And so if those muscles are tight, they're going to irritate the nerves, and you're going to create this whole cycle of irritation, not only of the bladder wall, but the pelvic floor and all that sort of stuff. But hun, listen, if you're bedridden at this point in time, it is time for you to up your game. We got to figure out why you're bedridden. What the hell is going on in your pelvis? Do you have Hunner's lesions that have not been treated? Is it super tight muscles? Is it a Tarlov cyst? Is it endometriosis? Is it a fibroid tumor? You deserve better than where you are right now. And if you have exceeded the ability of your clinicians to help you, then it is time to move on. And what a lot of people don't know is you can actually talk to some of the national specialists by email. You can email them, share your case, ask if they would be willing to treat you. And, I think ultimately in the end, your ability to document your symptoms and the nuance of your symptoms. When is it the best? When is it the worst? Where does it feel? Where does it hurt? Is it to the left? Is it to the right? Is it low? Is it high? Is it internal? Is it external? Let's see here. What are you saying here? Kay says, I need anxiety meds and they prescribe Prozac and my amitriptyline, but I'm not sure that's the best choice for PFD. Well, those aren't necessarily going to help pelvic floor. It's not going to help your muscles, but it might help you as you're getting through this so that we can get you back to where you need to be. Here, you know what? You guys hold on a sec. I'll be right back. Hold on. You know what? I cannot get this Cheap Trick song out of my brain. I want you to want me. I need you to need me. I'd love for you to love me. I am singing that song. I've been singing that song for 24 hours. Okay, so they prescribe Prozac and amitriptyline. That's certainly potentially going to kind of help stabilize your emotions and all that sort of stuff, and maybe help control the anxiety. Although, honestly, you know, one of the things you might benefit from is an antihistamine, Vistaril, which can not only calm the bladder wall, but has a very lovely beneficial side effect of having an anti-anxiety effect. But ultimately, in the end, you are an anatomical mystery to be solved. Your urogynecologist says it's pelvic floor dysfunction and doesn't think it's IC. So, what kind of pelvic floor work are you doing? Who are you going to? And the other thing, Kay, when I work with patients on the phone, when we do coaching, okay, so you say your onset started like a light switch. One day you were fine, the next day you were bedridden. What happened that day? What happened in the 24 hours before your symptoms began? Anything? Did you fall? Car accident? Did you have sex? Was it extremely stressful? Were you moving? Were you lifting boxes? Had you just had a baby? Okay, think about the 24 to 48 hours before your symptoms began. Any clues? So you guys, when I'm looking up, I'm looking at Facebook. When I'm looking down, I'm looking at YouTube. And so you guys, this is going to be the equivalent of office hours. I don't really have a formal presentation for you today. I'm going to start doing a lot more office hours this year to try to free up some of my regular time so that I can get work done. Getting work done is important. I have a lot of stuff I want to write. All right. So right now we're working with Kay on YouTube. Kay is bedridden because of pelvic floor dysfunction. She said, nothing happened, but you had taken antibiotics recently. You had a bad reaction to Bactrim. Hon, I had a bad reaction to Bactrim, and my ears have been ringing ever since. I had ear roaring. In fact, I was supposed to fly to San Diego it, within 2 weeks after it happened because I was supposed to chair an IC event in San Diego, and I couldn't get on a plane because I had a semi idling in my ears for 3 months. And even though that worst sensation's gone, my ears are ringing constantly because of that. I don't know a Bactrim causing muscle issues like that, though. Let's look it up. Hold on a sec. Let's just go to Bactrim and let's see what drugs, let's see what the, so let's look. So let's see, you're not supposed to take the medicine if you got liver disease, kidney disease, anemia, low blood platelets, or if you take Tycosin or Tycosine. This is exactly what I reacted to. One pill and my ears started roaring. I cannot take Bactrim at all. Okay, so typical side effects: stomach pain, skin rash, yellowing of the eye, seizure, new or unusual joint pain, increased or decreased urination, swelling, bruising, irritation around the IV needle, increased thirst, electrolyte balance, low blood cell counts, nausea, vomiting. All right. So, do you have joint pain or is it pelvic floor pain? Do you feel like it's muscle pain? Like, so somebody with really severe pelvic floor dysfunction, their muscles are so tight they cannot urinate easily. So, okay, when you try to urinate, can you start your stream right away or do you hesitate 5, 10, 15, 20 seconds before you can relax enough to empty urine out of your body? Oh, girl. Wait, wait a second. Wait a second. You later found out you had a a cyst 3 inch near your tailbone, which they just surgically removed? Yeah, girl. Yeah. So the cyst could have somehow had an effect on your pelvic floor all these 30 years, but I never had symptoms of a tail gut. Uh, uh, it sounds like it was a Tarlov cyst. It sounds like it was a Tarlov cyst. Yeah, absolutely. Because Tarlov cysts are little pockets of spinal fluid that emerge in little pockets that come out of your spinal cord. And unfortunately, what can happen is as they come out, they compress and impact nerves that affect your pelvis, that affect your bladder, especially if they're around L4, L5. And so the fact that you had that surgically removed is a good thing. That's a very, very good thing. And yeah, that really could be at the root of a lot of these problems. How long have you been bedridden? How long have you been stuck in bed? Betsa says, how long does it take after a fall to heal? Betsa, it depends upon what's broken. I mean, if muscles are injured, oh gosh, I just read a paper on that. 6 weeks? I think it was 6 weeks. Okay, says it was a duplication cyst that happened during your development as you were growing. Interesting. So, how long have you been in bed, hun? And what state do you live in? So, you've been in bed since October 1st. You had this cyst surgery December 10th. Are you feeling any better with the surgery? So, you live in Texas. Okay. So theoretically, one of the things that we could say is that your body in your pelvic floor is in an extreme kind of lockdown, for lack of a better term, you know, because either a pain that the cyst could have been causing, or, I mean, I guess the question again, is it muscle pain or is it joint pain? Okay, I'd love to talk to you. If you want to give the IC Network a phone call, I really like good. You're a little better. Your doctors are ditching you because they took some of your coccyx and you reattach pelvic. Oh, girl. Yeah. You know what? There is a physical therapist on Twitter, and I don't remember her name, who had to have part of her glute muscle removed, and it was a very, very, very long recovery for her as her muscles kind of adapted and compensated for the loss of those muscles. So you are in an extreme rehabilitation situation. Yeah, of course, I wouldn't expect you to be able to do pelvic floor right now. Yeah, you're kind of like me immediately after my hysterectomy. I couldn't really move comfortably for 10 months. So you're now in that post-op recovery phase, and so work with your doctor, work with your physical therapist, learn about a little bit more in terms of how to recover from pelvic surgeries. You know, One of the blogs online that I really, really love, and this is for everybody watching. Here, hold on, let me get it. I want to get let's see. I want to make sure I get it right. I don't want to give you the wrong one. pelvicpainrehab.com. pelvicpainrehab.com. They are, in my opinion, one of the best teams of physical therapists in the world when it comes to pelvic floor dysfunction. They have offices on the East Coast, I think up in Massachusetts. And then they've got offices up and down the state of California. Their blog is fantastic. Honestly, they let me reprint them in our magazine quite a few times. Their most recent one is Enjoying Sex While Healing from Pelvic Pain Explained, Endometriosis. Anyway, honestly, I think you're going to need to kind of cruise through some blogs that talk about surgical recovery. If you can relax where your pelvic floor, and I can't even tell you that they're locked. I don't know. I mean, you are in an I don't even think, you know, it's just your case is very, 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 very complex. You are a post-op surgical recovery patient. As you said, your muscles are extremely weak, and because they're weak, they're overcompensating by getting tight. And so you are going to be on a very slow but consistent pelvic floor rehabilitation plan. I would strongly encourage you to invest in a couple of books to read while you're recovering from that surgery. On, let's see here. Where's the other one? Oh, I already had it out, didn't I? Oh, I already have it out. I strongly suggest that you get this book, Ending Female Pelvic Pain. And honestly, I would get a second book too. I would get Heal Pelvic Pain. And you need to read and absorb everything they're saying about trying to recover, retrain, rehabilitate the pelvic floor. Okay. Yeah. Yeah. I mean, it's doable. It's very, very doable. I mean, I'm living proof that it's doable because I was torn fairly significantly during my hysterectomy 2 years ago. And at literally 3 months later, I felt like there was a fist up my vagina pulling all my organs out, and that lasted for 10 months. And my surgeon was like, "That's normal. That's normal." And it's like, "No, it's not normal. This is bad. This is creepy. I don't like this." 10 months later, when he sees me again, he goes, "Oh my God, I can see your muscles quivering. You're having involuntary muscle spasms." And physical therapy fixed it. So, all right, let's take some other questions. Kay, girl, I support you 100%. You can do this. I want you every day to start with a couple of affirmations. I am strong. I am confident. I am determined. I'm going to get through this. Okay. Betsa says, how can you tell if it's muscle pain or joint pain? Wow, if I have some type of system, my lower back, I have to find out. Well, I mean, muscle pain is, um, well, gosh, they're both triggered when you move, right? So there's no doubt about that. Gosh, I don't know if I can really answer that question well. How do you tell if it's muscle pain or joint pain in the pelvis? I have SI dysfunction, which is a bony dysfunction, which is a joint issue on my left side. And I will tell you that when I move in the wrong direction with that, it is very, very sharp pain. Whereas pelvic floor pain is a little bit duller and has a bit of a burning quality to it. Muscles that are working hard are muscles that build up lactic acid. It causes a burning sensation. And so we know you have muscle issues if you cannot start your urine stream right away, if you cannot have sex comfortably, if you dread going to your annual pelvic because you know it's going to hurt when they put the speculum in because your muscles are so tight. Again, if you're struggling with constipation or urinary retention, things like that. Ultimately, in the end, though, there's no you have to go to a doctor and ask them that question and have them do a proper diagnostic workup on you. Um, Linda, hello, Linda from Indiana. You have blood in your urine when you saw your urologist. Was it visual or was it microscopic? Because if it was microscopic, that's very routine. Hello, Michelle. Libby says she has a really important question. Do you know can the pelvic ganglia be involved in pudendal neuralgia? I'm not sure, hun. I'm not sure. Dorothy says, can Hunter's ulcers come back? Yes, and they can go away too, spontaneously. It's the crazy thing about ulcers. Hunter's ulcers, I see subtype 1, also known as Hunter's lesions. I've got pictures of them. Let's see. Okay, so these are here, hold on. These are hold on. Here we go. Okay. So this is 16 pictures of different Hunner's lesions in different patients. Hunner's lesions are characterized by having a center spot of dark, this usually dark red, that when you biopsy it, it is filled with inflammation, massive inflammation happening. This is the only subtype of IC where you see extreme inflammation. So what does the inflammation mean? Inflammation means your body is fighting something. Your body is fighting something. Inflammation is a sign of basically a war happening in your body. Your body is mobilizing the white blood cells to that area because your body says something is wrong. The mystery of Hunner's lesions, for many, many years has been, how do they develop? Well, we've got two operational theories, but there are more. Operational theory number one is that it is the site of a nerve that is massively inflamed. And when nerves are inflamed, they release something called substance P. And substance P damages tissue. So theory number one is that this is a site of severe inflammation, and substance P is being released, which is damaging that tissue. Theory number two emerged from Europe about 5 years ago, where several different studies in Europe at different research centers found virus. They found active virus in the urine of patients who have Hunner's lesions. And when they compared that to the urine of patients without lesions, the patients without lesions didn't have the viral load. The patients with these had the viral load. And so, like canker sores, you know, uh, canker sores get active and then they go quiet. Viruses live on nerves. So there are times when they can be active and cause problems, and they can be quiet or in remission. And so we know that I was just working earlier this week with a lady who had a really wicked attack of Epstein-Barr several years prior, and she had pretty wicked lesions. And there's a very good chance that the Epstein-Barr virus is in her bladder. And so that would explain why they kind of come and go potentially. The other thing to think about is, of the therapies. So we've always known, for example, that Elmeron never helped viruses. I mean, never helped lesions. That lesions were basically unresponsive to most of the traditional IC therapies, and which is why now we do lesion specific therapy. If we cauterize the area, which basically would kill that nerve, the pain usually goes away or improves dramatically. If they inject a steroid into the center of the lesion to fight that inflammation and calm down that nerve, again, the symptoms improve dramatically. Um, we know hyperbaric oxygen therapy, where you give the body a nice, good supply of oxygen, that also helps calm inflammatory conditions. And I think the thing that's the most interesting is the treatment called Liris, 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 which currently is shelved. Allergan is not using it. That was the first treatment in history to heal completely Hunner's lesions in just 2 weeks. 2 weeks of therapy, Hunner's lesions disappeared in many, many patients. And quite a few of them have been in our chats. And so the question is why? Well, Lyris is a medical device. It's like a soft, hollow piece of spaghetti. And what they did is they put lidocaine in it. And it was originally created by researchers at MIT as a way of delivering medication to the bladder for long periods of time. Because of the problem with treating the bladder is you pee medication out. So it's very hard to get, quote, dwell time. It's very hard to get enough time for medicine to be effective in the bladder wall, right? So they created what they call Lyris, or the lidocaine pretzel, soft hollow piece of spaghetti. It looks like spaghetti or noodle, filled with medication. Stick it up your urethra. It turns itself into a little knot, so it won't come out. And for 2 weeks, it delivered lidocaine 24 hours a day, 7 days a week to the bladder wall. Now, what does lidocaine do? Lidocaine numbs nerves. Isn't that interesting that when you numb nerves, lesions go away? So, in their first research study, which again, they were going for bladder pain, they had Hunter's lesion patients in the study, and they were stunned that lesions disappeared. And in every subsequent study they did, including new studies just for Hunter's lesions, that's exactly what they saw. They saw lesions disappear. They saw lesions get smaller. If a patient had 5 lesions at the end of the therapy, they might only have 2. And so one of the great tragedies that has happened, one of the really, really sad stories that happened is that Allergan, quote, deprioritized this treatment with no explanation. The normally when a medication or a medical device is deprioritized, it means that the company doesn't believe that they're going to make money with it. So here we have the first treatment in history to heal Hunter's lesions completely in a substantial number of patients, in a significant number of patients, and patients can't get it. It's so sad, right? So sad. So what you're left with again is steroid injection. The advantage of the steroid injection is it doesn't leave scar tissue. And the hyperbaric oxygen therapy, the challenge with the cauterization is it does leave scar tissue. All right. Now, I threw this out to somebody else, so we know polyoma BK virus, which we all have. We're not talking sexually transmitted diseases here, guys. You can just let that go. Polyoma BK virus is something in the human biome. So when a patient is immune compromised, sometimes that virus gets turned on in the bladder and causes hemorrhagic cystitis. We know Epstein-Barr. Um, um, the question is can we do antiviral therapies? And nobody's studied that yet with IC, with lesions. And I think it's time. I actually emailed my contact in Europe last year and I said, "So you guys are actively excluding viruses, but what do you do when you find a virus?" And the answer is like, "Well, we don't really know what to do yet." And so one of the things for anybody who's ever had canker sores, right? I mean, normally, canker sores is a herpes virus. The vast majority of people in the United States and around the world have them. Usually, we get it as kids when people kiss us. Um, when I have an outbreak of canker sores, I suck on lysine. I suck on lysine, and or I use a lysine chapstick. And it's amazing how effective it is. So I did suggest to her, I said, you know what, why don't you try taking a little bit of lysine just out of curiosity, see if it works. Who knows? I mean, lysine is an amino acid, it's remarkably safe, it's commonly used for anybody struggling with a cold sore or canker sores. It might be interesting. Why not? Sarah got a bad bladder infection, been so poorly, I think that it went to your kidneys. Doctors left it a week before antibiotics. Not good. So, Sarah, hopefully they've done proper antibiotic sensitivity testing to determine which is the most effective antibiotic to treat your unique infection. Do you know what the infection is? Is it E. coli, staph, strep? Did they tell you? And guys, let me just say here, it's very, 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 very important that you start tracking that information. You can't don't just accept a doctor saying infection. You need to ask what kind of infection is it? And I don't mean bladder infection. It's like, can you please identify the bacteria for me? Because if it's the same bacteria over and over and over and over again, then you may have a drug resistant infection, or you may have something in your environment that keeps repopulating you. If it's a different bacteria every single time, then that helps us focus a little bit more on your overall health and the health of your immune system. So please, as you're doing your medical records, and listen, if you go over to the IC network, go to our free download area, you can download a medical records kit, or if you're an ICN member, it's right on your member page. Download your kit. You can track all your tests. You can track everything. You can track your treatments tests. It's perfectly free, guys. Do it, use it. it's important that you track that information, track the results of your testing. Michelle says, Happy New Year. Anything bladder friendly to take when sick with common colds as far as over the counter meds? Michelle, actually, the support group meeting that I did on Sunday, we did a 5-hour support group meeting. That was the main topic. And so, if you can go to our meeting from last Sunday, either on YouTube or Facebook, and watch the first 30 minutes, you'll get all you need on that. Basically, honey, 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 honey. IC patients do the best with things that have honey in it. Okay. Also, if you go over to the IC Network website and you go under self help, I have a whole section on cold and flu strategies. I've got actually two on cold and flu strategies. Cecilia, I have been having UTI after UTI, 3 rounds of antibiotics, and the pain has been so severe. So, Cecilia, what kind of infection is it? Hi, Betsa. Hi, Cheryl. Betsa, how long does it take if you fail to heal? I don't understand your question. Libby says she was bedridden with pelvic floor dysfunction and pudendal neuralgia for months. Yeah, especially the pudendal neuralgia. Absolutely. Molly says it's been difficult to sit, sometimes lay back because of pain between the outer vulva. It makes it difficult to walk. Your mother is coming out of the hospital this weekend, wants me to help her. Any ideas on how to get through this? Well, hon, we've got these great chair cushions that have grooves down the middle so that nothing is touching your vulva. The challenge though is that you're having trouble walking. I have the cushion right here. We actually are now carrying a couple more chair cushions too, and where are my samples? Okay, this is our main chair cushion, and look, you'll see it has a groove down the middle. So each butt cheek is supported, but nothing is pushing up against your vulva. So for sitting, if you've got extreme vulvodynia, that would work. Hold on, let me see if I can find, where did I put these samples? Oh, here they are. Okay. Woo, this is the first time I get a demo of that. Look at this. I even get to take it out of the plastic. Hold on. I don't think we have these active in our store yet. I just got my first order. Let's see here. So this is a cushion. Now granted, our Costas cushion is very inexpensive. Like it's in the either high 20s or low 30s. But it's really only going to last maybe 6 months. It's a foam cushion. The more you sit on it, the more you push air out of the foam, eventually it will get flat. So our cushions they're affordable, but they're not particularly durable. Um, Pelvic Pain Solutions has two different types of cushions, and the quality is exceptionally good. The fabric is good. It's far, far better than any cushion, that of the cushions that we sell. But the challenge with these is that they're going to be in the $80 range, $70, $80 range. But with this cushion, look at the face through there. That's funny. You can you can flip it depending upon where your pain is. If you've got rectal pain, you put the groove in the back. If you've got vulvar pain, you can put the groove in the front. So the quality of this cushion is far, far superior. And then the really cool thing, they made this for me as a demo. Look, it has our logo on it. This is a fold up cushion that you can carry with you. And it's absolutely fantastic. So it is just like ours. So you can see there's a nice big groove in it. Again, this works for anybody with tailbone, vulvodynia, urethral pain, prostate pain. I will try to get these up for sale on our website right away. And I even have some that have the logo on it. I've been waiting to sell these, but they were just too expensive, and I just didn't think that. And we also had some. I wanted them to make sure that there were no fire retardants or anything in the foam, and that's all been addressed. So These are pristine cushions made in the United States. But, Molly, getting back to you, that you're having pain between the outer vulva. Normally, when people have trouble walking, it's because of dryness. And so, have you tried something like coconut oil? I mean, I noticed for me, given the fact that I'm a little bit older too, when things get dry down there, I can feel that when I try when I'm walking. So it's supposed to be slippery. Your mucous membranes are supposed to be slippery. So be an experiment to see how you did with something like coconut oil or V Magic or something like that, right? Cecilia said she also had a bad reaction to Bactrim. Yeah, my ears have been ringing much more intensely the last month, and I don't quite know why. It drives me crazy. Part of the problem is earbuds. You know how you accidentally put your earbuds on and you turn your music on and it's way too loud and you rip them out of your ears? I've done that a couple of times. Ramona just had a new InterStim put in today. My first one was in 2012. You've had good results. Awesome, hun. That's great. I hope I heard that Medtronic is coming out with a new neuromodulation device that is going to have a 15-year battery lifetime, but it has to be charged weekly. Dr. Ken Peters emailed me about that in December. So it's really good. We've come so far from the early days of InterStim when it was a really big, bulky device that caused a lot of infections, a lot of pain. Things are getting better with InterStim, but it still requires constant monitoring. Cheryl says, "What do I think of the new treatment with? It's called platelet-rich plasma. It's getting good results so far. It's just not very. It's not." Widely available as yet. If you're at a university, you might have a chance of giving it a try. I've covered it in our magazine. Platelet-rich plasma is certainly one of the more new promising therapies. Kim says, I have 3 Tarlov cysts and 2 doctors said it was dangerous to remove. I have horrible pelvic pain. Girl, listen, make sure. Now, remember, you got to remember the difference between local, regional, and national doctors. Tarlov cysts, especially if they're complex, would absolutely challenge a local doctor. You wouldn't want a local doctor to tackle a really intricate surgery like that, but that doesn't mean that a national doctor might not be able to do it. If you can get a second opinion by going to a university and research Tarlov cysts a little bit more and try to find who the best in the nation are, and go get a second or a third or a fourth opinion. Libby says she saw Stephanie Prendergast at Pelvic Health and Rehab. Stephanie Pendergrass is literally in the top 5 of physical therapists in the world for pelvic pain. You are so lucky you were able to see her. She practices in Los Angeles. Hi, Kirsty. Christy says, does physiotherapy work? I start mine in on Tuesday. Absolutely, it works. And in fact, when the first research study came out, that was a multi-center, it was an IC study done by the IC Clinical Trials Research Network at the time. It was at multiple centers around the country, including one center up in Canada. The data was released in 2008. And honestly, pelvic floor physical therapy was more effective than any other therapy ever studied up to that time, including Elmeron and all the other stuff. And so you absolutely should start pelvic floor physical therapy if you have pelvic floor dysfunction. Remember when Dr. Christopher Payne released his subtyping system for IC 5 years ago? Remember, one of the things that he said is how cruel it is to tell every single patient this is incurable and to tell every single patient this is an incurable bladder disease, because it's not an incurable bladder disease in many patients. So when we look at the 5 subtypes, we look at subtype number 1, Hunner's lesions, subtype number 2, bladder wall injury, often from estrogen atrophy or from chemical injury or from infection of some type. IC subtype 3 is the biggest subtype. That's pelvic floor injury. IC subtype 4, pudendal neuralgia, or which is a nerve injury. IC subtype 5, central sensitization. We can cure pelvic, pelvic floor dysfunction with the proper therapy. And guys, listen, I've been a support group leader. I started my support group in 1993. I am that freaking old, right? And we knew from the first 10 years of running that support group that there were a lot of patients who did not respond to traditional therapies. They didn't respond to any oral medication. They didn't respond to Elmeron. They didn't respond to hydroxyzine. They didn't respond to Elavil, nothing. Now we know why. Because it really wasn't their bladder, it was their muscles. And that's why every good pelvic pain clinic, every good urologist in the world should do a proper pelvic floor assessment at your very first appointment. Now we know tight dysfunctional muscles, as well as tailbone injuries and all sorts of things like that, can trigger bladder symptoms, frequency, urgency, pressure, pain. It's the chicken or the egg dilemma. Which comes first, the chicken or the egg? For us, it's which comes first, the bladder or the pelvic floor. The reality is that they're both involved because they're so intricately connected, but one is normally driving the other. So for some people, IC begins after a bladder injury, like if you were exposed to ketamine or radiation or chemotherapy, or you drank way too much Mountain Dew, okay? Your bladder wall gets fried, it starts screaming, your pelvic floor compensates by getting tight. We call that a guarding reflex. Our therapeutic priority for that group of patients is to calm and soothe the bladder. We know when we calm and soothe the bladder, that the muscle should also release, okay? But that's not the biggest group. The biggest group actually are patients whose symptoms begin after having a baby or being in a car accident or a fall or a history of athletics. If so and for those patients, their symptoms began after some sort of muscle trauma, a rape. Okay. Now, you have no clue that you have a muscle injury, right? You have no clue that anything has happened with your pelvic floor. Your first symptom is frequency urgency. And you naturally think, okay, this must be an infection. You call your doctor, the doctor prescribes antibiotics. Even if your culture is negative, under the assumption that maybe it's infection, the antibiotics don't work. You go back to the doctor says, hey, maybe it's overactive bladder. They give you overactive bladder medication. Those don't work. You go back to the doctor goes, okay, maybe it's interstitial cystitis. They put you on IC medications and you're stuck on IC medications for months or years, really never getting better. And the reality is, for these patients whose symptoms begin after a muscle trauma, none of the bladder treatments are going to work because our therapeutic priority for those patients is very, very different. Our therapeutic priority is to restore blood flow, to restore oxygenation, to restore nutrition to the bladder. Why? Because tight muscles restrict blood flow. It's very hard for the bladder to be healthy. It's very hard for anything down there to be healthy if it's being squeezed by tight muscles. So, our therapeutic priority for the pelvic floor patient is to restore blood flow. How do we do that? By releasing muscles. We want to release and relax those muscles. So, you know, muscles generally are supposed to be long and lean. I'm wearing a sweatshirt right now. So, normally your muscles are flat and long and lean. But if you pop a bicep, which you can't see, but mine is small anyway, you would have a tight bundle of muscles. A long and lean muscle is like this. A muscle that's working hard, the fibers slide together like this, and they create this contracted bunch, which is stronger, which can support more, right? But but this is an example of extreme tightness. So the therapeutic priority is to try to get this bunch to release. And it's interesting when you look at how muscle fibers work. Muscle fibers have little pili. And so as they slide together, the fibers on this finger and the fibers on this finger, the little pili attach. They attach. And that's what creates the strength there. These little thousands and thousands of pili on these muscle fibers. But sometimes they get stuck. and you could have a muscle knot. And if you have a muscle knot, you know what happens when you got a muscle knot on your back? You have somebody push on it, because when you push on it, sometimes it causes those muscles to release. Or you have somebody rub it and try to lengthen it. And a lot of pelvic floor physical therapy is about lengthening. It's about lengthening. So your muscles, and this isn't anatomically correct, but it's a fair way of demonstrating what they do. What they are going to do is use their fingers and slide it along the length of the muscle to try to get that muscle to flatten out and be normal again. Sometimes they will go the lengthwise, and sometimes they will do this kind of movement, or sometimes they will use their thumb and go like this. They will do a curving movement because your pelvic floor curves. You've got muscles that go from the left to the right, front to back, low to high, and and you've got muscles that kind of curve up like this. Right? I can't really explain that. That was one of the last things that my pelvic floor physical therapist wanted me to do, was to do this curving upwards. So Kirsty, girl, dive into it. Go for it. Listen, it's also really helpful to make sure you try to get the name of the muscle that's the issue, whether it's a levator, piriformis, obturus, whatever it could be. Okay, so that when you come back, you can read more about it. You can read more about how to rehabilitate that, what to do and what not to do. And again, this is, you guys, if you're a pelvic floor patient, please, please, please invest in one of these books, which will guide you through how to do your various stretches and exercises. And this brings up my new project. So hold on a sec. So I am working now on hold on. It's something that we started last year, and then with all the fires and stuff, it just didn't work. I'm working now on what's going to be a box filled with your best flare management stuff. It's going to be filled with heating pads. It's going to have it's going to have a bunch of stuff in it, right? But because I want you to be able to have your flare kit in your bedroom, ready when you need it, right? It's going to have affirmation cards, but what I'm excited about is it's also going to have cards that are going to give you rescue plans. And so now the graphics aren't done, but we were working on this last night. So for example, you're going to have a card that's going to be for bladder wall flares. And it's from 1 to 10, all the things that you should do in order when you're having a bladder wall flare. Okay. And then I hope to have this done in a month or two. There's even a new supplement that's going to come out later this spring, specifically for flares, that might go in this. So look, we also have one for pelvic floor flares, what to do. But this is what I was working on last night. I'm going to have cards in here that you will be able to use. Hopefully everything will be laminated to walk you through if you're having a pelvic floor flare. It's going to walk you through in order the things to do to relax these muscles. And right? So you'll just be able to work your way through these. And nobody's done this before. I mean, I just want you to have something super, super easy that you can use. So this is my big project for the next week, right? Because ultimately, in the end, there's a reason why your muscles are tight. The reason why my muscles are tight is, number one, I was an athlete. Number two, I've got scoliosis, which means that my hips are slightly out of balance. I know you can't see it. It's an S curve, but I'm supposed to be an inch taller. I'm 5'9". I'm supposed to be 5'10". So my hips are slightly out of level, one is slightly higher than the other, and that has created long-term pelvic floor challenges for me. So it's not like it's a quick fix. This is about retraining your body and getting those muscles healthy again. And you're going to be doing muscle work for many, many, many years. Because if you don't, and you hurt those muscles again, it's just going to go right back to where you were. So I'm excited about doing this kit, this pretty box filled with things that when you have a flare, you can open it and it's going to give you lots of things that you can do to try to address that flare. What do you think of that idea? I've been wanting to do it for years. Kirsty says you're running out of options for your bladder. Kirsty, I hope you'll give me a phone call. If you can, go over to our website, icnetwork.org, go to the contact us page and pop me an email with your phone number and I'd be happy to call you, or you can call our 800 number later this week. I'd love to talk with you. I bet we can come up with some more options, but ultimately in the end, we cannot have a good discussion about your treatment options until we understand what your subtype is. So first and foremost, we have to try to figure out what's triggering your pain in the first place. What subtype do you fall into? Hello, Nanette. Nanette, I love your name. I think I told you that before. My favorite story as a young girl was Nanette and the Chateau. I still have the book. Lily says, can you have IC with a normal cystoscopy? Absolutely. Absolutely. What that means is that okay. Let's talk about that for a moment. Um, the purpose of a cystoscopy is to examine a bladder wall. And as you know, we've got two types of cystoscopies. A typical in-office cystoscopy is a 5-minute procedure. They numb your urethra, they stick a scope in, they look around, they pull it out, you're done. The purpose of that test, and I call that a looky-loo, is just see if there's anything weird going on. Like, do you have a bladder stone? I showed a picture of a patient with bladder stones. Look at this. Look at that. Holy hell. Can you imagine having that floating in your bladder? So the purpose of a looky-loo, an in-office cysto, is to look for stuff like that, right? And many people, bladder stones are actually remarkably common around the world. Less so in the United States, but they certainly do happen. This is a United States patient. Um, so they're going to look for really gross physical abnormalities. Most IC patients have normal cystos. Um, it is the hydrodistension with cystoscopy that will allow the doctor to really closely examine the bladder wall and will allow them to potentially identify Hunner's lesions. However, if you're blessed to have a doctor who has something called narrowband imaging, they can do a plain in-office cysto without stretching your bladder at all. And if it is a specific type of cystoscope, it will identify Hunner's lesions too. But one of the key signs of a Hunner's lesion is when you fill the bladder with water, it starts to bleed. The little lesions will bleed profusely, even with very, very small amount of water. But again, look at the subtypes. Okay, my bladder is completely normal. You look at my bladder, there's not a red spot on it. What am I drinking right now? Decaf coffee. Because my subtype is not IC subtype 1 or IC subtype 2. My subtypes are IC subtype 3 pelvic floor and IC subtype 5 central sensitization. So tons of patients have normal cystos. That doesn't mean that they don't have pain. It's actually good news. It means that your bladder's pretty good. Now we got to look for other things outside of the bladder that could be triggering your symptoms, like your pelvic floor or a fibroid tumor or a Tarlov cyst or endometriosis or whatever. Linda says, can we take turmeric capsules for inflammation relief? Girl, you just got to try it and see how you do. You know, I'd love for people to tell me, anybody out there, do you take turmeric and does it hurt you or not? Becca says, your life is ruined. Becca, I'm going to challenge you. If you talk to me on the phone, I bet we can figure stuff out for you. I would absolutely love to talk with you. No charge. Guys, our phone line's free. It's an 800 phone line. I double dog dare you to give me a phone call and let's see if we can figure out what's going on. I bet we can, or at least give you more things to pursue. Lauren says, "Hey, Jill, been a while. You're recovering from surgery. Girl, I'm glad you're over your surgery and you're in the recovery process." Suzanne says, "I love my last order from the IC Network. Pre-Leaf IC Cookbook, Luvina. Pre-Leaf is cheaper here than Amazon." Yep. And guys, I just want to thank Pre-Leaf. Pre-Leaf, hello, who makes these live streams happen. They are a sponsor for these live support group meetings. Pre-Leaf is an acid reducer. It's the oldest supplement that's been out there, 30 years or more. It's a simple calcium pill, kind of like Tums, different form of calcium that helps reduce the acid in your urine. It doesn't act on your bladder directly. It just makes your urine less irritating. And so if you've got to go somewhere where you know there's going to be something irritating, you can take a little bit of pre-leaf ahead of time, and that will help reduce that acid load so it won't irritate your bladder so much. Of course, I come from a less is more perspective. I don't believe in taking a lot of anything, especially for myself with extreme sensitivity. Please do not eat pre-leaf like candy. It is calcium. That calcium's got to go somewhere. And what we don't want you to do is to do so much calcium that you end up with these, right? Excess calcium can lead to kidney stones. Okay, speaking of coffee, time for a bio break because I've got to pee. I'll be right back. All right, I'm back, but I need to open a window too. Open a window. Oh, I'm sweating. Now, I don't know about you guys, but every year to save money, I pick a color that I'm going to wear for the year. So last year it was for the first time in like 30 years, I wore a lot of black, a part to rebel, my protest color. This year, my color is pink. So I'm going to be wearing a lot of pink this year. 2 years ago, it was gray. I'm weird that way. I'm one of those people who my brain is organized by colors. It's there are all sorts of learning tests and learning styles. And for me, um, my brain is organized by color. It's a very, very rare learning style. It's like only 5% or 3% of people have it, where before I write something, and this is, guys, you're going to think I'm nuts, but I've been this way my whole life. I have to know what color I'm writing, the color of the project, before I can write the project. And as you can see in my office, I don't know, let's see. You can see everything is organized by colors. I can't not do colors. And even my project board, right? Colors. All right. I should have some water too. I haven't drunk any. You know what? Let me go get some water. I'll be right back. All righty then. IC principle 101. Lots and lots of water, right? I mean, not lots of water, just you got to keep your urine nice and hydrated. 4 to 6 glasses of water a day. If your urine is a pale, clear yellow, you are perfect. If your urine is brown or dark yellow, you are dehydrated. You need to drink some water to dilute your urine and make it less irritating to your bladder wall. If your urine is clear, you are overhydrating and potentially risking your damaging your electrolyte balance and potentially risking your health. Don't drink gallons of water a day. Look at the color of your urine. Okay. Hi, Chris. Hi, Chris. Hey, I missed a phone call from you earlier. Sorry about that. Chris says, do I think a low dosage available is appropriate for treating frequency urgency? A low dose of Elavil has been used for decades in the IC community. And when I say a low dose, I mean 5 to 10 milligrams. The theory behind Elavil is an antidepressant. It's an anticholinergic antidepressant. They're not, don't be offended if a doctor suggests an antidepressant to you. They're not giving it to you for depression. They're giving it to you because in low dose, it helps to modulate nerves and kind of calm nerves down. So you're not normally taking 75 milligrams a day. You're normally taking 5 milligrams at night. The challenge with Elavil are the side effects. It causes weight gain, sugar cravings. It can give you an irregular heart rate, dry eyes, dry mouth. I couldn't take it. It really messed my heart up. But I can't take Sudafed or anything like that because I get a racing heart. But I think more concerning, Chris, honestly, is the fact that anticholinergics have now been linked to cognitive decline. That if you take an anticholinergic or a number of anticholinergics every day over a period of 3 years, especially if you're over the age of 50, there is a significant risk of cognitive decline and dementia. So, for that reason alone, I think it's probably time to look beyond the anticholinergics to other medications, and instead I would talk to your doctor about other options for you. Okay, I think that I petitioned the American Urology Association chairman of the IC committee, and I said, don't you think we should put the anticholinergic medications in Elmeron in step 4 instead of step 2 because of the risk of causing permanent damage? So I don't know. Knowing what we know about it now, I don't see Elavil as being a first line treatment anymore. I just don't, especially if you're older. Vicky says, do anticholinergic antidepressants cause or exacerbate IC? No, not that we're aware of. So Vicky says, what causes subtype 3? I'm new to learning about this. You're talking about it. Injury, trauma, accident. So if you've fallen on your tailbone, if you've fallen off of a horse, if you've ridden a bicycle or a motorcycle for long periods of time, if you've been raped, suffered any sort of pelvic trauma or history of athletics where you're a gymnast or an ice skater, or if you were in the army, paratrooper, football player, anything that involves trauma to the pelvis. Marcia says, on your previous podcast, you mentioned a wonderful lady urologist in Atlanta. I believe her name is Denise Pecht. P is in Paul, E, C is in Charlie, H is in Harry, T is in Tom. Denise Pecht. And you can find her over on the IC Network website, icnetwork.org. Go to our Find a Physician database and listen. That's our other one of our other big projects for this year. And a couple months ago, I asked for any IC patients to send me a resume who was interested in working for us, updating this database. And one of you did, and please don't take it personally that I haven't gotten back to you yet. I don't remember your name. I apologize. I try to only hire IC patients because I don't want you to think you cannot accomplish anything. And we are going to be expanding this year. I intend to hire several of you to help us with various projects. So if you are interested in working from home, if you have experience as a writer and you would like to write articles for us for our website and our magazine, that would be fantastic. If you would like to help with social media campaigns, guys, paid, not a lot, but I'm willing to pay. So think about it, okay? I mean, I think that's one reason why we've been as effective as we are because we're all IC patients. So we know what life is like. So we know kind of what we're dealing with and what to write about. Vicky says, "Oh my gosh, I have scoliosis, one hip higher, one knee and one shoulder higher." Yeah, girl. So your pelvis is compensating for that. Your pelvis is like this. And believe me, that's going to affect your pelvic floor because your hips are not working together. Your hips are potentially kind of working in opposition. Well, not quite opposition, but they're not working together well. All right, who's texting me? All right. And guys, if you like these meetings, make sure that you like our Facebook page, subscribe to our YouTube page, come on over onto Twitter. You can find me at IC and Jill. We're going to be expanding over to Instagram. We'll be doing other stuff. You can find us on Pinterest, all that sort of stuff. But oh, hell, it's hard to keep up with all that stuff. I want to be doing IC research. That's why I'm going to hire people, more people. Allison, I have hunters. My specialist asked me if I would consider bladder removal mainly because it's so hard for me to go places, even short distances. I would say no, but would it be worth having a catheter? At 59 years, I detest having to go to the bathroom so often, going to meetings. Well, so Allison, one of the things that they sometimes do with Hunter's lesions is they do a bladder resection where they just cut the lesion out. So kind of number one, it depends on how many lesions you have. If you just have one, is it in a location where they can cut it out? That would be a viable alternative to bladder removal. And I just got, where is it? There is a new female catheter that, okay, hold on. Oh my God, it was so interesting. The question is who sent it to me? Hold on, let me look at my Facebook messages. So it's an external catheter for a woman, and it's attached to a very simple, quiet little pump device. So you can sleep with it and potentially travel with it. So imagine kind of a tube that's like this long, that is kind of like the shape of a tampon that you can put between your legs, between your vulva, and if you leak, there's a little tiny section with the tube that will pull that fluid out and it will collect with a pump. And so that could be something that potentially you could travel with. Hold on a sec. Let me see. It's on my other computer. I will try to find that because somebody suggested that we sell it and we can't sell it. But hold on. Let me just go to this computer for a minute. Let me go into my history on my. So when did I look at that? It was so cool. I wonder. Oh, here it is. Here it is. Here it is. It's called Pure Wick. Well, yeah, that's it. Pure Wick, Purewick. I bet, Allison, you could drive with that. I bet you could. I'd really like to get those Hunter's lesions treated, though. I mean, so are you doing anything for the lesions at all? I think it might be really interesting to explore hyperbaric oxygen therapy. We did a big article on it in one of our magazines. So Holly says, can you have two subtypes? Absolutely. Absolutely. Listen, if you've got pain, you're gonna have subtype 3. If you've got bladder pain from chemo, you're going to have pelvic floor dysfunction too. But again, it's the chicken versus the egg dilemma. Which comes first, the chicken or the egg? Which comes first, the bladder or the pelvic floor? I have a video over on our website, Vicki, called The 5 Subtypes of IC. Watch it. Give it a watch and then give me a phone call. Hi, David. Hi, Colleen. Christina, how do you get to speak to me? Easy. You just call us. Call the IC network. 1-800-928-7496 is a phone number. I will tell you that I often return phone calls late into the evening. And if I can, I try to call back that day. If I can't, I will try to call you back within a couple of working days. But I generally call everybody back who calls. What I want you to do is do your work first. Come on over to our website, watch a couple of videos first. Watch the 5 subtypes of IC, the 6 steps of treatment, and if you're a woman, the estrogen chat. If you can watch those videos before you call me, that would be great. You can also sign up for wellness coaching in our store and get a significant period of time, an hour with me if you want. But, guys, people call all the time. I'm on the phone every day. My urologist told me I don't have IC because my bladder is normal under the scope. Thank goodness my family doc knows better, but my workplace disability plan only listened to specialists. No wonder many patients are so frustrated. So many reasons. At least I know I'm not crazy thanks to a progressive family doctor and to you. Oh, hon, I'm so glad. Lily, can you recommend a urogynecologist in San Diego? Dr. Bruce Kahn at the Scripps Center would be the one that would come off the top of my head real quick. Bruce Kahn, Kahn. Jessica says, I do best with 3 liters of water a day. Girl, it depends upon what your urine looks like. You got to look at it. If it's clear, you're doing too much. If it's dark yellow, it's not enough. Everybody's different. Jean says, I've had lots of tests, lots of pain this week. I've had lots of tests. So I saw my doctor today and she says, nothing wrong with your bladder. Remember, I live in the UK. Okay, so Jean, then we're looking outside the bladder. We need to look at your uterus. We need to look at your muscles. We need to look at your spine. We need to look at nerves. So make an appointment with your gynecologist and it's time to say, listen, I got pelvic pain. I'm struggling with these symptoms. I'm trying to figure out why. Can you please help me rule out my reproductive system? Could it be my uterus? Could it be anything in my uterus? Could it be anything in my vagina? Do I have estrogen atrophy? Anything at all like that? Okay. Guys, for anybody who's interested in working for the IC network and doing stuff, just send me an email. Just go to our website, go to the contact area and send me an email. Okay. Courtney says, if you have pudendal neuralgia or irritation from tight pelvic floor muscles, how long does it usually take physical therapy to resolve this? Well, it kind of depends on why your muscles are tight in the first place, right? So, there's definitely a group of patients whose muscles, in fact, I was working with one like 2 weeks ago or before Christmas, somewhere in there. And what he was saying is that he was great for 24 hours after physical therapy, and then bam, it all came back. And the question is why? What is there in his daily life that is continuing to trigger muscle tension? And usually it's some sort of bony dysfunction, usually scoliosis, hips not working together, SI joint, something like that. So, if you find that you have chronic muscle tension, we need to figure out why. And normally there's some sort of skeletal abnormality that can be part of the problem, or something as simple as you sitting on a bike. If you like bike riding, not understanding that sitting on a bike puts direct pressure on the pelvic floor muscles. All right, YouTube, I apologize, my YouTube followers. Let me take a look here. Kay says the Flare Kit needs to encouraging books and cards. Yes, believe me, we've already got them designed. I really love what we have for that. Dominica says, is pelvic distension common with IC? I look 3 months pregnant when I'm flaring. My lower abdomen is so tight. Yeah, it is. We call it the IC belly. We asked Dr. Theo Harides, the one of the top IC researchers years ago at Tufts University, and he said it was basically kind of inflammation, that you could wake up with a flat belly and then 2 hours later look 6 months pregnant, all because of inflammation, and that it kind of tends to come and go. So that's kind of one theory on why that happens. But why? But see, now, Dominica, you say something in here that's really interesting, and that you also say that your lower abdomen is tight, and that to me is more interesting in what you said, because we got to figure out why your abdomen is tight. Is it because you're in pain and your pelvic floor muscles are getting tight? That's possible. I would really love to know the health of your pelvic floor. I just got an email from somebody who I think is in here right now about turmeric, and that is our turmeric capsule safe for IC? It's one of those things that's very individual. You just got to try it, see how you do. It's not necessarily on the super bad list, but we've never put it on the good list. Vicky says a study about if Hunter's lesions can be cured through a whole food vegan diet needs to be done. I mean, what causes them in the first place? Inflammation from what? Meat, dairy, alcohol? Well, again, Vicky, as I explained earlier, the biggest clue we have about lesions is that they could be viral infections, and that they're a sign of inflammation, neuroinflammation. And so I agree with you. It'd be fantastic to have a study about studying the impact of diet on the growth of Hunter's lesions. The challenge is finding somebody who will pay for it. There's no, anytime research studies are done, generally they're either going to be funded by the National Institutes of Health or some sort of urological foundation. And usually, I mean, I sat on the US Army research panel for 10 years where we picked studies to fund, and I can tell you they would never have funded that study. We need more data, and what we really need is a graduate student who would like to do their senior project or their dissertation on that. That's possible. I mean, and we've helped several grad students collect data. Alice said, had your hunters treated by diathermy in May? You had 6 at the time, but some have healed and have left scar tissue. Yeah. Courtney says, my physical therapist seems to think it's due to hip weakness on that side. Absolutely. She's probably very right on that. Holly, what is the best thing to do in a flare up? You got to figure out the type of flare you're having. If you're having a bladder wall flare from eating the wrong food or from hormones, that means your pain gets worse as your bladder fills with urine and is relieved by urination. Then you need to do the bladder rescue plan. If you're having a pelvic floor flare, you need to do the pelvic floor rescue plan. So again, if you go over to the IC network, and if you're already a member, you can download from your member page our flare management guide, which gives you hour by hour rescue plans. But if you just go on over to our website, icnetwork.org, and sign up for our free newsletter, you will get us a gift, our flare management guide, where you can get the hour by hour plans for each one of the flares. Okay. Hello, Kathy. All right, guys. Well, listen, I could only do this for an hour and a half. I've got to go do something in 5 minutes. I've got to go to an appointment. So I'm going to have to shut it down early, but I will be back and you're going to see more office hours coming throughout this year, in addition to our regularly scheduled life support group meetings. All right. So I will see you guys again. Make sure, come on over to our website, sign up for our free newsletter. So you're going to get all the new announcements for anything. Make sure you like our Facebook page, subscribe to our YouTube page. And if you have questions, you're always welcome to email me, icnetwork@mac.com, or you can come on over to the IC Network website, call us on the phone, 1-800-928-7496, or use our contact form. Alrighty, I gotta pop. I'll see you guys later. Have a good one. All right, YouTube. Sorry, I gotta go. I will see y'all later.